So this is the bamboo box for the used for the moxibustion purpose by activating the single point. By activating to the single point. Anywhere we wanted to use it, definitely we can use it. This particular point I just placed on the apex of the ear. We all know that a specific point to be known as a pi hui. Pi means 100. Hui means is some kind of the connectivity or some kind of the junction, because there is the numerous points having the one connectivity point to be known as a pi hui, where all the young meridians are communicating and connecting this point. When this point is activated by using the moxibustion, that means, so we are using this on the top side. Now just after igniting this, I wanted to place it downwards direction. You just put it downwards direction. Now there is the inside, you can find
mesh.
The mesh. So this to be known as a mesh, but this will not fall down the ashes. Because ashes also having the medicinal properties, we all know. So that having this ashes can be used for the beauty and cosmetic purpose, especially the beauty salons people will take these ashes, should be utilized and applied for the bleaching purpose and also for the massage purpose of the facial region. So now this belt also is there. In that belt you can find there are the two buttons here. This is the one button, the other side is the another button. So this belt is very long belt and we can use it. This has been made only for the DU20 purpose, or only one particular point to be activated by using this bamboo. So now just you place on the DU20 region and then bring down this belt to the downwards direction and on to the apex of the ear till you can place it like this, because DU20 pi hui point is located on the exactly fine-tuned proximal and also apex of the ear. Now we have placed this, and now you can feel in 1 minute time, because the direct moxibustion showing on the skin surface, it takes 30 seconds to get hardness and heat over that region. But however, because of the mesh is there, it takes maximum 1 minute to feel some amount of the sensation of the heat on that particular region. Once we should place precisely, that's very important. Sometimes we can put it backside of the behind the ears, or we can place it on the ears also. Make sure that the point to be located here on the exactly on the fine-tuned proximal. However, mesh is there. That mesh is passing to the another 2 points, those known as a houting and then chanting. Pai hui is the center point, and then behind that is houting, and anterior to that point is chanting. Chanting is DU21, DU19 and then DU20. Collectively, this is the 3 points activation by using the single moxibustion. That means it's really it is required to regulate, because this particular point is located on the crown chakra. At the same time is the temporal arteries and then temporal nerve, frontal nerve and then occipital nerve. All are communicating to one particular junction, that junction to be known as a pai hui. So therefore this particular point, when the heat is very less in the brain, that means the person having the psychological or the emotional disturbances, mild to moderate, and then the person doesn't sleep or he sleep oversleep. That means both the conditions, definitely this will be applicable. At the same time, this point is located on the middle of the cerebral cortex of the brain. So at the same time, this will be really helpful to dilate the blood vessels in the central nervous system, because we all know the circle of Willis. So Willis are, consider on that particular region, that also regulating and reaching to the various arteries supporting, like a basilar artery and a posterior and anterior and the middle cerebral artery. So anything having the defect on that particular region, definitely that will be helpful to dilate the blood vessels on that particular region. You remember the person is suffering for the chronic headache and migraine, other cluster headaches. In that condition, oftenly getting the problem where the patient feel low energy always and fatigueness and lethargy due to the thyroid related disorders. diabetes related conditions, but of course diabetes have the contraindication, but all other indications, definitely this point will be useful to treat for the day-to-day clinical practice, the person having the headache and any kind of insomnia. Of course, you should not use insomnia for the longer intervals, minimum 5 to 10 minutes or maximum it is recommended. How the people will consume the tea, after taking the tea they will go and sleep. Some of the people having the habit. However, tea is the stimulant, but at the same time theophylline, theobromine and caffeine, so that is the stimulant, again the people will consume and then take and then go for the bed. And also heart therapy, you know, the foot bath therapy is there, that will be really good. So once they dip the leg and they will get the good nice sleep at night times. In the similar way, this also is the herb which is dilating to the blood vessels and also making calm down to the blood vessels also when having the positive feedback mechanism and negative feedback mechanism in the acupuncture. So in the similar way, this moxibustion also activating to one specific point, that point to be known as a point DO20, that is the sedative point and also having the tranquilizing effect in the body. Due to that reason, if we activate this point, minimum is for 10 minutes to 15 minutes is recommended. Minimum the moxibustion to be taken place practically 15 minutes to 20 minutes it is recommended, or sometimes 25 minutes. But the blisters will happen here, chances are very poor, because the moxibustion is the complication is blisters, pustules and then any kind of the carbuncles or scars having the chances to get the person. In that condition, if it is not there, because of the Ulcers is there. When you wanted to protect again, we can place it one tissue under the skin, that means on the under this box, and then we can place it. That also for the safety purpose we can use it in that way. Otherwise we can directly with hairs, without hairs also can be recommended to use the DO20 moxibustion. Always you remember this one point is recommended to treat for the top diseases, to treat for the down and vice versa. The patient is suffering for the foot related problem or the lower extremities causing the pain and numbness, even that condition also it is recommended. At the same time, the people who are suffering for the any kind of the brain hemiplegia, paraplegia or tetraplegia, quadriplegia, anything is connected to the paralysis, facial Bell's palsy condition, also recommended to use this particular point. However, we have seen this is as a calming effect. Are you feeling more hardness? Very light hardness, because mesh also is there. So slow and steady, we can keep it around 10 minutes minimum, maximum is 20 minutes is recommended. This to be known as the bamboo box moxibustion on the one single point to be activated by using this point. So always you remember how do we do the hijama or cupping modality. So that similar way this point also activating. Now we wanted to shift some other places. Now we wanted to use for the chanting. Then we can use on the anterior region of this point, where the point to be known as a Shang Ing. That means is the Shang Sing. So these are the DO23 and then Shan Ting DO24. So these are the point to be activated on the anterior region, and especially we wanted to activate to the lateral, slightly lateral side of the body. Definitely that condition also when we wanted to apply, this is the Mi Chung, this is something is Hanyam, Swanlo, Swanli, Chubin. Other points also can be activated by activating gallbladder meridian points. At the same time, the urinary bladder meridian points also activated by using this kind of the modalities. Now we wanted to shift to the other posterior side of the head region. Now we can shift this to the posterior side. Then definitely we are using to the, make sure that should not cause the harmful to the body and should not fall down on the other side. So now we have seen that entire which we call as the sagittal suture and then lambdoid suture and coronal suture. All the sutures can be governed by using the different points on the center of the scalp region. This will be really helpful to treat for the hemiplegia related disorders as well. When the bleeding is happening, hemorrhoids has happened internally, that condition it is not recommended. Anything the posterior or the middle cerebral artery get stagnated or stenosis or blockages, so that particular region definitely this will be helpful to treat for the paralysis conditions. So do you have any doubts on it?
No, sir.
So you can use in this way, keep it this with you and you will get in the market and you can place it with you, and whenever it is possible, the patient is phobia having that to take the needling, that time definitely you can use this kind of the modality as well. So what kind of the feeling do you have right now?
It's pretty warm.
So feeling the warmness, that warmness is really required for the promotion of the chi and then blood inside the brain system. When the chi blood having the stagnation, so that particular time the movement of the chi is not happening, or the chin A, which we call as a body fluids, which we call as a left ventricle, third ventricle, lateral ventricles, where the cerebrospinal fluid secretion to be taken place, that secretion also taken place precisely at the same time, the movements also to be taken place. Once this cerebrum will activate, that will be support to the small brain or the hind brain. When those are good, then that will be support to the entire spine, to the spinal cord as well. Right? Are you okay? Shall we remove now? Good. See this? You can hold like this, and then you can see that this you should not make it burn over here. If keep burning that will going to burn the mesh. So we should not touch that. That's the reason there is a one stand also inside.
Spring.
There is a spring is there that will hold. You should not touch to the mesh downwards direction, otherwise that will burn. You just place it slightly above the level of the mesh, and because you don't feel burning sensation. Right. So now the another point to be known as when we wanted to activate the one specific point, you just want that please. So when we wanted to treat by using the single point, yes, exactly, on your spine position. So now I think we can withdraw this. Now we just place it on the abdomen. So abdominal related disorders, definitely this will be helpful. Now I am placing to the Chung Wan. Chung means is the center, Wan means abdomen, right? So now I just placed this on the abdominal region, specific point to be known as a Chung Wan, Xia Wan, Qian Li, and then Shang Wan. These are the points known as a stomach. Ren 10 is Xia Wan, Ren 11 is Qian Li, Ren 12 is Chung Wan, Ren 13 is Shang Wan, Ren 15 is Chu Chu, Ren 15 is Chiu Wei. Right, all these points to be activated. You wanted to use as a double. You wanted to use as a 2 points activation. This point for the single activation, and when we wanted to use for the double places. So this also you can see. See, now there is a spring over here, and when you wanted to insert and then place it, you wanted to insert, ashes should be placed in the pan or bowl, right? Now I just placing this downwards direction and then just putting down. So now I don't want to touch to the mesh, just I am placing, and this is the magnet. You can find there are the magnets are here, 1, 2, 3, 4. 1, 2, 3, 4 magnets are there, but here also magnets. So once you place like this will catch, right? So this attaches to the bamboo. Now I wanted to activate the 2 points at a time. For example, Chungwan and then Siawan, I wanted to activate. Then you remember this, just I am placing like this, right? So now at the same time you are activating to the 2 points. Now there is one more thread also come over here to band like this, to fix it to the abdomen. But however, if the patient is comfortable and some therapist is next to him and he is taking care of it, and definitely there is no thread also required. Otherwise you can knot from this side to this side, that also good. And the flame which is there, aromatic fumigation, that comes out through these channels also. You can look at here. Yeah. There are the 2 over here. This is in and out. because we do require, this is the in is going, out should be there. In and out, both the air to be passed. That's the reason they kept as a 4 holes over here with a mesh. So that's the reason patient feel more comfortable if we place for 20 minutes. Maximum 30 minutes also can be placed over on the abdominal region. Slow and steady, you will get the natural heat sensation to that particular region to strengthen, because I told you there are the 2 points which I told you, Siavan and then Chungwan, Shangwan. The stomach can be divided into 3 parts. One upper part to be known as a cardiac sphincter, and a middle part to be known as a, that is the Shangban. REM 13 will be applicable to treat for the cardiac stomach or the cardiac sphincter of the stomach or the upper part of the stomach. The middle part of the stomach and fundus of the stomach to be treatable by activating the single point. That point to be known as a Chungwan. Chung means is the center, Wan means is the abdomen. And then the third point to be known as a Siavan. Siavan is the REM 10 point. So that point to be activated for the lower abdomen, especially for the pyloric sphincter. Now we are activating to the entire stomach, because those 2 points, but because this you understand 3 points it covers over here, but you are, wherever you are placing, then you understand that particular organ to be activated by using this modality. Now we wanted to use anything, you understand the celiac artery is there, at the same time is the intercostal nerves, abdominal aorta, and then mesenteric nerves, and then arteries which circulate through these channels and through these particular points. When we wanted to use another point, now I wanted to use focus to 1 or 2 points on the chest region, because the people who are suffering for the respiratory illness, the respiratory disorders, for that condition you just place it on this region. That will be really helpful to treat for the numerous diseases. I am audible in the Zoom?
Sir, we are not able to see anything, sir. Camera is upstairs.
Yeah, now I think you can able to see now. Is it not possible?
Thank you, sir.
Yeah. You can raise the question in that way if you can't. But however, now you can see the point to be known as a Shang Zang, that to be known as a REN 17. When we wanted to activate the single point, you can withdraw this and you can place it only 1 moxa on this particular region. Otherwise, you can use the 1 single moxa. Also, you can place it in 1 particular region. You just place it like this, right? And then you just take off this and make sure this is ashes are there. Don't rub in that particular region and place it somewhere else, right? Then you can place it over here, right? Don't touch to the mesh over here. So now we are activating to the single point. So ask the patient itself is hold this for some time. Otherwise he is comfortable, let it be there the same. So now this is activating for the respiratory system. Especially we wanted to use some of the points on the Chung Fo, that is the lung 1 point. We just ask them to activate this point. At the same time, we can place it on the other side on the chest region, because this is really required for the pulmonary system, especially to elevate the heat. When the cold is excessiveness in the lungs and which heat is very poor, or the dryness is there on that particular situation, definitely we can use. After completion of this procedure, it is recommended to ask him to drink the hot beverages or hot liquids or the hot water at least. Warm water or the hot water is recommended to drink the after moxibustion to every patient. Now there are the most important points I would like to recommend you. Here we wanted to place it. So now you are activating to the Chi Hai. You know the Chi Hai is the beautiful point. Remember, you are activating to the Chi Hai point. Chi means is the energy. Hai means is the entire body energy is stored on that particular region. That is the beauty of the Chi Hai. Remember, once you activate this particular point, you are activating to not only that energy is required to the lower abdomen. Of course, you are activating to the entire body system to be activated by using the Chi Hai point. At the same time, when you wanted to treat for the Kuan Yuan point to be known as a Kuan Yuan, the point to be known as a REN 4. Now the REN 4 point is located 3 chun distal to the navel. Right? Kuan means is gate. Kuan means is the pass. Kuan means is the pass or the gate to enter. Yuan. Yuan means is the original or the source of the energy. So that is the reason Chi Hai and then Kuan Yuan, both the points are very, very good point. Now I am just focusing this. So make sure patient should sit comfortably when wanted to do it, or the practitioner should sit comfortably and patient should lie down in the proper position. So now just I am focusing this in this direction. Just I place it, this is 1 inch above the skin surface. If there too much hairs are there, then definitely we can take the upward direction. Then we ask them to show to the superior level or slightly lower level, and the patient feel in 30 seconds, I believe the patient started feeling there is some amount of the heat on that sensation. Now the heat is there, you just is passing the heat. So now I just switch over to the Kuan Yuan point, that is the Ren 4 point, right? Ren 4 is it is the source point of the energy. Remember, that's the reason these points are to be known as a homeostatic point, tonification point, immune enhancing point, energy boosting point in our body, and also life changing in our body. The root of the energy to be activated by using this particular point. So if you feel more hot, and please let me know.
Hot more?
Now he is telling hot, but I am shifting again to the Chi Hai. Right. So once you touches to the hairs will burn, so that will burn to the skin and derma as well. But make sure that should not happen. So this is the complication of the acupuncture, moxibustion. Now I wanted to treat for the Chung Chi. So Chung Chi is the point to be known as a Ren 3 point. Ren 3 fortune distal to the navel on the central line. So this is the one type of the method of the pole moxa or the roll moxa to be used in this way. Now I wanted to activate the entire abdominal region by using the points known as a Shui Fen. Shui Fen is the Ren 9, Tian Shu and Huang Shu. Huang Shu is the kidney 16, Tian Shu is the stomach 25, and then Ta Heng is the spleen 15. So I wanted to activate, and also the Chi Hai and the other points is the Kulai and then Shui Tu. These are the points, are the stomach points. I wanted to activate for the Hara diagnosis. Hara diagnosis is the Chinese diagnosis, and Chinese diagnosis modality. I just use the this kind of the modality. We just rotate this. So this to be activating to the entire system of the navel. If the navel is good, then the lower geo also good. If the lower geo is good, upper middle geo also good. If the navel is good, then the chest cavity also good. So therefore, once the lateral side, right and left side also can be possible to activate this. So are you feeling some kind of the heat? So please tell me. So you just use it in this way. This will be really helpful to activate for the entire abdominal system, especially for the umbilical hernia. Also can be treatable, right, by using this kind of the technique. Now I wanted to use as a single point. So that particular time I wanted to use as a Shenzang. You just place it on the Shenzang point. That means this is Shao Sung. This is Ren 17. So now too much hairs over here on the chest region, and you touches that causes that burn the hairs. So that should not be. So please give it me the pan. So I think who have the cigarette smokers, they do have the good experience to do. Keep the ashes away. So now you just try to see, when you feel the heat, please let me know. Yes. Still you can manage?
Yes.
Tell me what is there?
Yeah,
Excessive heat, right? So in this condition, definitely you can see that will not burn over that region. Now we understand overall. Now we wanted to apply on the Qingmen. Qingmen. The Qingmen, the point to be known as a liver 14. Right. Qingmen, Jimen to be known as a gallbladder 25. So we wanted to use the gallbladder 25 and then liver 13. Sangmen. So these are the points are really good. You are activating to the spleen and pancreas. At the same time you are activating to the kidney system. Right, Sangman, the point is located on the where it touches the olecranon process of the ulna at the free end of the 11th rib. So that point to be known as at the end of the free 11th rib, this point to be known as a Sangman. Right, at least 1.8 chun distal to this point to be known as a, this the back side, this to be known as a Qingmen, that is the gallbladder 25, is the kidney point. So we just activate, give the maximum time. So now I'm standing, I'm not comfortable. This is not the procedure to give. When we sit comfortably and then ask them to give place and with the right procedure. Right? In this way we need to keep doing the same. At the same time I just show you on the back that point to be known as a Mingmen. So where is the Mingmen point? Mingmen is second lumbar vertebra. So this is once you come down, this is called as a first tuphius line, this is called as a second tuphius line. So remember, this is the second tuphius line, this is as a second tuphius line, this line to be known as a first tuphius line. Right? So now the first tuphius line is there, so you just come down, this is called as a second lumbar vertebra. Right. So on the second lumbar vertebra distal to that. So if you feel the heat, please let me know. So I'm just placing that, and this guy is very fortunate and he is taking at the cost of the free treatment. Right. So how much you are going to pay for me? How many dollars? Tell me at least Indian bucks. 10,000. Thank you for that. He's going to pay me 10,000 rupees per section. But US dollars will charge only the $100 or $75 each section. But he is paying me more than $100. Thank you for that. Are you feeling the pain?
No, sir.
No sensation?
Feel the heat, sir.
Heat is there. No pain. Right? Until you manage, and please let me know. I don't shift the moxa next level.
I can feel the heat and pain.
Too much?
Little. Stop. Yes, sir. Now it is much.
So I wanted to shift, you mean to say?
Sir, yes, sir. Sir. Sir.
Some more.
Yes. Until the patient feel very hot in this region, right? Patient feel the heat, right? So in this way, this the Mingmen is a very beautiful point. At the same time, we wanted to see the Peng Huang Shu or the Shen Shu. Shen Shu is the point to be known as a Shen Shu. The point to be known as a is the UB23, UB23 point, UB24, UB25, UB26, UB27, UB28. UB28 is the Peng Guang Shu. Any bladder related problem can be treatable by activating this specific point. You just activate this point to release the pudendal nerve and sacral nerves, and then pelvic nerves will release once we activate these points. At this, are you feeling? Yes, good. We'll shift to the other point. His bladder also will bring more energy. I think tonight you just relax, right? Don't do any activities because this young is more active now. Yes, are you feeling? Yes. Right? Now we wanted to do for the knee pain especially, we wanted to do it on the V Chung point. Definitely we can use the V Chung point. Especially we wanted to activate on the UB40 region. We just activate these other points. And apart from that, when you wanted to burn this or when you wanted to stop this, at the same time put the water on it. Better you just take the mug of the water and then put it under that till here only. But have the chances to burn the cloth also. Now you just place it till here till the tip, at least 1 centimeter above the burn area. You can make it in this way, and then make sure that the whole fire has been extinguished. Right. Now you just keep it safely on the, especially on the metal. Right. Now we completed this one kind of the procedure.